Syphilis. Syphilis is considered a genital ulcer disease. Prior to antibiotics, this disease had a major negative impact in the United States. It is still an issue worldwide as well. The disease is divided into 3 phases: primary, secondary, and tertiary. Phase 1, 2, and 3. Primary, you see an appearance of a genital ulcer called a canker. Secondary, you've got multiple organ systems that are infected. Symptoms include things like fever, headache, sore throat, a rash all over the skin. The tertiary stage is the highly advanced stage, and it's associated with gummas. These are going to be painful tumors of the tissue. Treponema pallidum is the causative agent. It is actually a spirochete. It is a strict parasite. It will not exist outside of the host. It has to have a host. It is rapidly destroyed by chemical and environmental factors. So on a surface or anything like that, you put Lysol on it or bleach and it's gone. So the pathogenesis, the microbe attaches to the mucous membrane or to broken skin. It multiplies and it enters the bloodstream. The infection now affects multiple body systems. Once it gets past that mucous membrane, now it can just infect everything. What is the treatment? Penicillin G. What's the prevention? Use a condom. Safe sex practices. Also, we need to be able to detect and treat those people who have syphilis. So I'm going to warn you, there's a picture that's coming up that is pretty bad. And it has to do with congenital syphilis. Mother has syphilis, doesn't get treated, and has a baby. Here's the syphilis Treponema pallidum bacteria. Like I said, it's a spirochete. This little boy right here has congenital syphilis. So this little boy was born to a mother who had syphilis and went untreated. It was awful before we had the advent of penicillin to have syphilis. So what are the symptoms that you see? Usually you will have painless sores. They develop within a month of the infection, but they may leave scarring. There's usually a rash. It's characteristic of the secondary phase of syphilis. And the thing about the rash is it is very highly contagious. Up to 12 weeks after the infection, you may have a fever that will occur, and that's because the syphilis has spread throughout the body. It's not a high fever, it's usually a low fever. As far as the nervous system goes, you will have headaches, you will have mood changes, neck stiffness. There are some others as well, but these are kind of the main ones. You may see hair loss in the eyebrows and eyelashes. The scalp is kind of the most common place that you will see hair loss. Disappearing of skin symptoms. So remember I said you have sores, you have rashes, and hair loss. Sores, rashes, and hair loss may stop. However, until the treatment is actually administered, the patient still has syphilis. It's not like it went away. First few years, no signs and symptoms are observed. Primary stage, you see the sore or canker that's found in the genital area, the inner part of the vagina in women, the penis for men. Cankers do not result in pain, and they'll disappear without treatment. The secondary stage, you get the skin rash. It's rough, it's red or reddish brown spots on the palms, on the hands, on the bottoms of the feet. Mucous membranes will have lesions throughout the body, but they don't itch. You may have fever, sore throat, headaches, swollen glands, so your lymph nodes may swell, weight loss, muscle ache, and fatigue. In the tertiary stage, now remember I said it affects the internal organs, so blood vessels, your heart, nervous system problems. Literally, it's going to damage your internal organs, and in some cases, it can cause death. In the latent stage, symptoms can disappear for 1 to 20 years, but you can still diagnose it through blood testing. The other thing is, kind of like herpes, you can have a relapse of symptoms. You can have symptoms again and again and again. Speaking of herpes, it's a genital ulcer disease. It is a very common infection, but it's still not a reportable disease. Infections are generally latent. The virus hides from our immune system between observable symptoms, just like the herpes that causes fever blisters on our lips. This will kind of go dormant and then come back. Signs and symptoms. It can be asymptomatic. You may not show symptoms at all. Single or multiple vesicles in the genital region. Remember, vesicle is a small raised area of skin filled with clear fluid, so it looks like an ulcer. Herpes lesions tend to be very painful. Other symptoms that can accompany those lesions include malaise, you're tired, anorexia, you don't want to eat, or you can have fever. After the initial presentation, after you first see it, individuals may suffer from recurring surface infections. Like I said, it goes dormant, but then it can recur. Generally, they are less severe than the original case, and throughout the year, over a period of many years. The causative agent is herpes simplex virus, HSV1 and HSV2, and they are considered to be latent infections. You get them, you have a flare-up, it goes away. You're not cured, it's still there, and it will recur. Pathogenesis. The virus enters the body, it infects the host cells. During latency, the virions actually hide out in the nervous system cells, and they will reactivate later to cause symptoms. Treatment. There are antiviral treatments like acyclovir and valacyclovir that are aimed at reducing viral shedding and decreasing the occurrence of lesions. Does it cure you? No. It just kind of prevents the worst of the symptoms. Prevention. Use a condom. Practice safe sex. So this is HSV1, and you can see that it has gotten on their eyes and under their nose. With genital herpes, HSV2, you again have that ulcerative rash that can happen on the penis or on the vulva. And here is the herpes virus itself. So the human papillomavirus. This infection is more commonly known as genital warts. Women under 25 years old are the most commonly affected population. Transmission is through direct contact. Generally, we're talking about sexual contact. And I'm sure you know this already, but it is associated with the development of certain cancers. Many cases of HPV are asymptomatic. They affect internal genital structures, which may be hard to detect without a medical exam. Without looking inside, it's very hard to see that you have HPV. If, however, you have a symptomatic case, they present with wart-like growths on the genital tissues. If you have long-term infections, chronic infections, it can lead to cancers of the cervix, the penis, the anus, or the mouth and the throat. So the causative agent, I'm sure you already know, is human papillomavirus. There are more than 100 different viruses that can cause this disease. So it's not necessarily just one. Only a select few are associated with the development of cancers, though. The pathogenesis. The virus enters the body, it infects the host cells, and it can stay in the host cells long term to cause chronic symptoms or even cancer symptoms. So treatment. There's no treatment for HPV infection. Warts can be removed, but it doesn't really treat the virus. It just means that the warts aren't there anymore. Prevention. Use a condom, safe sex practices, frequent cervical screenings for sexually active women, and there are 2 vaccines available to protect both males and females. If you watch television in the last 10 years, They have been promoting the HPV vaccine for at least that long. So the human papillomavirus looks like this. Here are the warts inside of the mouth. And again, you've got those genital warts that will be found either on the shaft of the penis or the vulva and cervix of the female. And they can also be found around the anus.